Hello everyone and welcome to the second half of Hello Doctor. I'm your host Dr. Jaigirdar, and today we've been talking about cancer. We have our expert guest Dr. Aikash. The first half we spoke so much about cancer, and honestly a lot of these questions I couldn't even get through because you were just answering them naturally, and your explanations, I must say, is brilliant because the way you just go into such a complex condition and you've broken it down to such simple terms, it's praiseworthy.
Thank you.
Dr. Aikash, I want to know a bit more about you because part of this show is also about empowering the next generation, is making sure that the next generation can aspire to great heights, be it academically or sometimes maybe not academically, but as doctors, we want to make sure as many people get into this profession as possible.
Yeah.
Were you always hoping to be a doctor, or what's your story?
So I have to say this because obviously our community watching this is mostly Asian people, I would assume. Yeah. So a lot of the children and teenagers can sort of resonate with what I'm going to say. And you know, when you're growing up, you don't really have much choice in what you wish to apply for at university. Yeah. And while I would 100% encourage someone to go into the career of medicine if they want to, at the same time, I wouldn't necessarily force someone to go into it, especially, for example, me being the first doctor of my family, as well as coming from a working class background. You know, there are many challenges within the field that no one in my family could have prepared me for or even knew existed, and therefore I went in, and you know, it was a rough journey in that way, so to speak. So I would say to anyone that wants to go into the field of medicine, get your work experience early, see what it's like on the grassroots level of what a doctor actually has to do, and see whether it is for you or not. If you make an informed decision, with the key word being informed, about whether this is for you or not, you're not wrong in making that decision either way. Yeah. However, I love medicine. I really enjoy it. It's why I'm still in the profession, 8 years on after graduating from medical school.
Has it been 8 years?
8 years, yeah.
Oh, goodness me.
It's time flies.
So myself and Dr. Aikash, we actually went to the same medical school. He was my senior. I know him very well in that capacity. But I remember the day you graduated. It's been 8 years.
It's been 8 years, yeah.
Oh, goodness.
So yeah, but for me, what I would say, working in healthcare and working as a doctor, the way I see it very different from every other job that I could be applying for, is that for me to be a good clinician, for me to be a good doctor, I have to be a good human being at the same time. And not many jobs actually require sort of the marriage of these two aspects of being very good clinically, knowledge-wise, hand-eye coordination and dexterity, but then coming across with honesty, sincerity, hard working, you know, making sure that I'm doing the most for my patients every single day, and then going home, you know, satisfied with that. You know, not many careers allow me to be both at the same time, as well as going home knowing that I actually made a positive difference to my community.
Definitely. Again, so you mentioned some of the challenges of being a doctor. Yeah. I know everyone has their own challenges. I have mine, you have yours. I want to hear yours. What are some of the challenges you went through?
So, I mean, the obvious ones being, you know, the amount of studying that needs to take place, difficulty regarding that, the night shifts, the weekends, you know, there have been a lot of weddings that I've missed, for example, because there were shifts that I couldn't swap with colleagues and so on and so forth. It's been a bit tricky sometimes, even, you know, getting Eid day off because of cover in the hospital. But the ones that you could say I was not prepared for was the specializing sort of pathway, because there aren't infinite numbers of training positions to get into every single specialty. That is very limited, and as a result of competition, you could say, then you know, you have to think about the ability to travel for your job. So luckily, I've been very lucky, I've been very fortunate to say that the furthest I've ever traveled for a job has been Kent. You know, but I know, for example, people that I've graduated with from medical school, you know, they graduated, they got the medical degree, but for the first 2 years, they were in Cornwall, for example, because that's just where they were stationed. And, you know, if you want to think about something such as neurosurgery, which is operating on the brain, or cardiothoracics, you know, the heart and the lungs, there are very few centers in this country that actually train people for this. And so you have to be willing to travel to get those skill sets. And so this is just something for people to think about, that it's not just you graduate, you go to medical school and you work at your local hospital or you just work at your local GP. that everybody gets funneled into a national sort of competition application program.
Yeah.
And then from there, the sieve happens, and then they decide, who scored the best and who's worthy of their training program. And then after that, it's, who gets priority in choosing where they want to be.
And I think if you even have a partner who's a doctor, you could be working in 2 different places altogether.
Exactly. Yeah. So in that way, a lot of sacrifices have to be made. And it's just about whether someone is willing to do all of that, or whether, someone has other priorities in life. And either choice is not right or wrong. It's just about what the person thinks is best for them.
I heard this very funny story. It's a true story because the person who was experiencing it told me. So he's a doctor, his wife's a doctor. He was on day shifts, she was on night shifts. The next week he was on night shifts and she was on day shifts. They lived under the same roof, but they didn't see each other for 2 weeks.
It happens.
I thought this is crazy.
Yeah, it happens. But every profession needs people that are dedicated to it, because if someone in our community has a problem, then there needs to be someone to take care of it. So for example, if everybody was doctors, but your car broke down, there wouldn't be a mechanic.
Yeah, true.
And if everybody was a mechanic and you started having a lot of chest pain, you were having a heart attack, there would be no doctors to take care of it.
Yeah.
So the most important thing, I'll probably say, when choosing your career pathway is about what are you taking care of for your own community? What is there a shortage of? And where do you feel that you can make the most impact with the skills that you have?
I love that word, impact. So instead of driving for, let's say, materialistic success, you're driving for impact. And when you drive for impact, the success just follows.
Yeah, that's what I would say,
Because you're prepared to put the hard work in.
Exactly.
I'm sure your job is never easy, emotionally and physically. The hours you do, sometimes you're starting earlier, finishing a lot later. And those are sometimes unpaid hours. Because we just do it for the goodness of the patient. Emotionally, I can imagine that some of the patients that you see, you're breaking bad news again and again and again. To the point, do you sometimes get scared that you're becoming almost distant from your emotions in that respect, or?
I mean, the problem is that when you work within cancer yourself as a field and a profession, the emotional distancing that you have from the sort of profession or from your day-to-day work, one, takes place, and two, every little pain that I get, and I think, oh, is it cancer now? Because obviously I see it so often. But I would say there is a bit of emotional distancing, but what I would rather say is that it's mostly an emotional reservation for scenarios that actually deserve it. Whereas, when you first go through your training, everything is new, and so everything requires a lot of devotion, even from your emotions. But then as you get more experience and you know about what's in your comfort zone, what you're able to quickly deal with, what's a more complicated situation, and then those truly heartbreaking scenarios, then you kind of gear yourself accordingly to be able to cope with those circumstances.
I think breaking bad news is a skill, and it's something that you get prepared for it from med school. And I remember once, I think I was in F1 or F2 at the time. I think it was F1, my respiratory rotation, and the doctor, the consultant who went and broke bad news that the patient, who was a mother to 2 kids, had cancer. Yes, it's the worst news that she could possibly hear, but I promise you, I think she heard it from the best person, because the way he broke it down, and he gave her time, and he explained the condition and what the next steps, and I think time was the most important thing, just saying what the bad news is and giving her time to absorb it.
And that's why, you hear it sort of in conversations sometimes between doctors, is medicine a science or is it an art? And I'm more inclined towards it being an art, because all my years of training within medicine, what I find is that my decision making is not necessarily based on protocols, but it's based on my gut feeling. There's someone that, their blood tests are normal, everything looks fine, but when you look at the patient from the end of the patient, just something's not right. And then based upon that, you make a decision, and then you find out that what you were concerned about was actually true. And I think at the same time, with a lot of aspects of medicine, and being a doctor requires skill sets from every part of your character. It's an art form, because you can get 2 people performing medicine in the same way, but then the satisfaction from the patient is completely different. And it's just about the way information has been conveyed and delivered to them. And that's ultimately what changes patient care and satisfaction.
Yeah, exactly. I think it is an art. You're in the field of oncology, so you're in the field of cancer. if you weren't in the field of cancer, what other field would you have gone into?
So I would probably say elderly care medicine.
Okay.
Yeah, and it sounds very different from the field of oncology, but something that I've realized within sort of my training as a doctor, one thing I do enjoy is looking after vulnerable people.
Yeah.
I admit that that is a very subjective answer and everybody has their own personal answer to that sort of stance. But for me, I find elderly people, especially in this country, very vulnerable because they're in a physical and sometimes mental state because of dementia, of being incapable of actually looking after themselves, incapable of actually conveying what their problems are and the impact it has on them and their families at the same time. Being a doctor, sort of sitting within that field and taking care of all of this is something that I did enjoy, and I have a lot of experience in elderly care medicine, but specifically oncology managed to trump that just from the experience I had while training in those jobs, and that's the reason why I'm in cancer work now.
Definitely. I think elderly care is also, elderly patients are some of the most cutest patients, I'll be honest. When you see the old grandma who's sitting there, and I've seen it time and time again, just this week alone, honestly swells up my heart because they are so, like, they're so cute and they're so honest and straightforward. But you mentioned something that we sometimes, dismiss, which is a lot of elderly people do go through depression. They go through mental health issues, but we don't realize it. We don't actually take it as an active part of what's going on with them as we do with maybe the younger patients.
Yeah, and I think as well at the same time, when we look at the lifestones that we achieve at this part of our age, we all have friends that are going through the same thing. For example, our close friends and our close family members, siblings and cousins, they're growing up, they're getting grades, whatever they may be at college, they're going to university, they're getting a job, they're getting married, they're having children. Whereas when you get to that sort of age, majority of people that you've known for far longer and have gone through all these milestones with them are now passing away. And that in itself can have a negative impact on that person because sometimes they think that they're just waiting their turn. And so, managing the health problems within that sort of scope, I find it very rewarding.
There was a study, and I can't remember the actual title of the study, but the point was they looked at depression within the elderly population and they saw those who are given a form of work almost and those who are not. And they found that depression was higher in those who did not have work. Now, I'm not saying go stick your elderly mother or your grandma to work or and force them do forced labor or anything like that. But I'm saying if you give them activities and you give them a purpose, studies have shown that depression rates decrease.
And I think as well it's because of isolation. Especially, in our communities, what's great is that sometimes you have multiple generations either in the same house or very close by to one another. And, that's why, a lot of children have very close bonds with their grandparents, sometimes often more than their parents because their parent has been a disciplinary person in their life, but their grandparent has been that nurturing, kind person that often, takes their sides in the little family bouts. So that, and I would say these kind of relationships really is a good preventative factor for mental health issues.
So would you recommend oncology to other doctors?
Yeah, but what I would probably say is, as I was mentioning before, we need people being able to make an impact in different fields. And that's true also within the field of medicine itself. Everybody can't be an oncologist because when I refer someone for an operation for their tumor, I need a surgeon. And so I think it just takes a little bit of sit down and reflection for a medic or a surgeon at that time, or a doctor, I should say, to think about what it is that they actually want from the field, what they're able to provide and what they're willing to provide. And then based upon that, make a choice about what they like. Because when I was in my first year of doctor, so I was an F1, a foundation year 1 doctor, I was working within this field of psychiatry for a good 4 months. And my consultant, he asked me what I wanted to do, and I said, I'm not really sure, just getting a feel of everything at the moment. And he said to me, you know what, Bilal, choosing a specialty is like marriage. It's not the good things you like, but it's also the bad things that you can live with. And I think, generally speaking, that's a very important factor when to take into consideration, because I can love, for example, neurosurgery. But am I willing to go through the very difficult competition ratio and as well the nights and so on and so forth that are required from it? Some people would say yes, some people would say no. And so it's about really what you're able to actually give to the profession itself. That is a major influencing factor in decisions about career.
I think, do you remember in medical school, when we were learning about a condition and we thought we possibly had that condition. I think it's called medical student syndrome.
Yeah.
Right? Do you have that now being a cancer doctor? Do you think?
I mean, to be honest, it's made me want to have a good relationship with my GP. Reason being is because actually if I'm getting sort of repeated blood tests done sort of every 6 months to a year, they actually see my face, for example. It makes it a lot easier for me to say, I've got this problem, what do you think is going on? Whereas, you know, someone who's not being able to have contact with a GP to keep on top of their health, you know, it becomes a lot harder to plug them into the system sometimes.
Yeah.
So, you know, what I would really, you know, encourage is, you know, if you're the age of 40 and above, you know, start thinking about your blood pressure, start thinking about cholesterol, and just engaging with your GP as a whole, so that whenever you do have symptoms that you're worried about, you're kind of already in the system with the GP to actually follow this up properly.
Definitely. I think GP basically was a family doctor. It was the family doctor who would come in and they would know pretty much all the family dynamics. They'll know about you, your health. And so when they said, and you touched on this, which is such an important point, you mentioned gut feeling, but it was more experience, I would say when a patient comes in, everything's normal, but something just does not look right. And that's what a GP can do essentially as well, because they've seen this patient again and again, and then the experience of knowing that person, they could say, yes, the blood tests and blood pressure and all the other obs are all normal, but something doesn't look right. So I think that's, you know, beautiful advice. Get engaged with your GP because that service is available.
Exactly.
It is hard to get an appointment, granted.
I mean, and also me being a doctor doesn't give me any greater rights to get access to the GP. I still have to wait, you know, however long it takes to get an appointment. But you know, perseverance is important.
Definitely. I did my GP rotation, so I know how busy they are. But once I had to call the GP and I was on the call and I was like, what's taking them so long? you
forget yourself.
Yeah, as a doctor, you forget yourself. Let's go back to talking about you yourself. So you mentioned that you would recommend this field to others, but given, you know, the circumstances, of course. But what was one of the most interesting cases you faced in the field?
Okay, so the reason why I find oncology interesting, as well as, you know, obviously the human aspects of it, is that you really have to be on your toes in your skill set, because a lot can go wrong because you're managing the cancer. Sometimes when they come into hospital, they're either having a complication of their cancer itself or the treatment that you've given, as well as their normal existing medical problems. So you really have to be on your toes. And so I was working as an oncology senior house officer, so SHO in abbreviating it. And we had one patient overnight that had lung cancer, but then started to have chest tightness. And so we scanned this patient overnight because, you know, the blood pressure was dropping, the heart rate was going up. And actually what we found was a tumor from their lung was spreading into the lining of their heart and was creating fluid. And this fluid that was also mixed in with blood was filling up so much that it was actually compressing the heart and actually caused it to stop. And so this was what we call a cardiac arrest situation. And then so we had to obviously perform the emergency protocol of chest compressions and the other parts of the algorithm. But then as well, we had to get the cardiothoracic surgeons, so the surgeons for the heart, to put in an emergency drain into the heart to actually drain it. And we were able to restore a heartbeat afterwards.
That is a pretty interesting case. Is the patient okay afterwards? Or?
Yeah, they were okay. But what they have is a permanent sort of slit in the lining so that doesn't happen again.
You know how modern medicine has changed is phenomenal. Like, you can't keep up with the guidelines because things are coming in and it's changing up the entire game of medicine.
Definitely.
You know, Ibn Sina, who was the father of modern medicine, what he broke down and to what it is now.
Exactly.
Is incredible, and it keeps on changing because of technology.
Yeah, and you know, in that light, you know, we don't necessarily experience it from day to day in terms of our work, but medicine is a heritage from the people that have lived and worked before us, and we've inherited their knowledge. We're practicing it, and then we're giving it to, you know, future medical students and training doctors as well. So I see myself as a link in that chain within the field of oncology now.
Another beautiful analogy. Quickly going back onto cancer because our time is a bit short. Is cancer contagious?
No. Yeah, but what I would say is that for patients receiving chemotherapy or treatments that are affecting their immune system in order to treat their cancer is to not necessarily be in contact with someone that's unwell at the time. Because your immune system is suppressed, you're at risk of not only catching infections, whether it be viral or bacterial or fungal, but because you don't have the immune system at that point in time to fight it, the reaction to this infection can be a lot more severe and life-threatening. So what could be mild in myself and yourself may actually be sort of life-threatening to a cancer patient that's on treatment.
Okay. And just quickly touching on the different treatments for cancer.
Fine. So bringing it back to the first part of our conversation before the break about the pathway of a patient. So we've got the staging, 1, 2, 3, 4, has it spread anywhere else? And then this really determines what happens to the patient.
Yeah.
And so we say that the single most curative outcome for a patient is surgery. But for a patient to be a candidate for that, to be eligible for this kind of treatment, the tumor has to be very small and contained and not necessarily spread any parts of the body. Yeah. Because if I've got stomach cancer and it's spread to my lung and it's spread to my brain, if I take out the stomach cancer via surgery, I've still got cancer remaining. Yeah. And that will still spread everywhere else. So if it's very localized and very contained to a small area, then that can be taken out surgically. Yeah. What happens then is, the surgery takes out the cancer that you can see with your naked eye, but it doesn't necessarily deal with what is microscopic and very sort of small on the molecular level. And so that's why you have chemotherapy. And so chemotherapy is treatment that kills cancer cells. Unfortunately, sometimes kills your natural human cells as well as a side effect, but it gets rid of what is not visible to the eye that could be cancer anywhere else in the body.
So it's a chemical?
So it's a chemical.
Yeah.
Some cancer treatments are in the form of tablets. Some of them are in the form of injections or infusions. You could say it runs over a few hours in a day.
Okay. Yeah. And then so you got surgery, chemotherapy, I think there's radiotherapy.
So there's radiotherapy, which is what I'm hoping to also specialize in.
Yeah.
So essentially it's high dose X-ray beams. So we say radiotherapy, it sounds fancy. You're not going to glow green and turn into the Hulk or anything like that. Yeah. But for example, if you've ever been unwell and you had a chest X-ray, you get radiation X-ray beams that fire through the lungs to light up an image, for example. Yeah. What radiotherapy is an extremely high dose of a version of this, basically. And what it's known to do actually is essentially when it's fired directly at the tumor, it breaks down the tumor cells.
Oh, interesting.
Yeah. So there are many functions of radiotherapy. Radiotherapy in and of itself can be curative of certain types of cancer, such as prostate cancer, depending on the staging again. Or sometimes we can use it in what we call the palliative, whereas, for example, the cancer is not curable, but we want to relieve them of symptoms. So, for example, we have a lot of cancers that spread to the back and causing compression of the nerves, and they can't move their legs as much. And so they have a lot of back pain because of the tumor being in the bones and touching upon the nerves. And what the radiotherapy can do, if it's fired at the back, can shrink the tumor cells and decrease that compression on the nerves, therefore providing some recovery to mobility and also decrease in pain.
Fantastic note to end with. I think you summed up cancer so well for us. There's so many questions I still wanted to ask you. Unfortunately, this is all the time we had today.
No, that's fine. It's been a pleasure to be on here.
Thank you. Inshallah, we can bring you back on.
Inshallah.
And we can finish the rest of the questions, because I'm sure myself, definitely, I've thoroughly enjoyed speaking to you and to the audience. Thank you today for joining in. Sorry, this is all the time we have today. Thank you, Dr. Akash, for coming in, and I'll see you in another episode of Hello, Doctor.